Hey everyone, this video is going to be a brief introduction into OCD. We're going to talk about its presentation, some examples, and then we'll talk about management. So let's get straight into it. We're going to start off by discussing what OCD is. And OCD is obsessions and or compulsions that lead to significant distress and dysfunction. So what are obsessions? Obsessions are intrusive, unwanted, repetitive thoughts, urges, or images that don't go away and are generally unwanted. So these are things going on in a person's mind where they have these thoughts that are generally unwanted and causing them distress. And now compulsions are repetitive physical behaviors or mental acts performed that are meant to reduce anxiety caused by the obsessions. So we said the obsessions are the unwanted thoughts, urges, or images that are stressful. And now the compulsions are what that person does in order to help reduce the anxiety that the obsessions cause. And so here's a nice little illustration kind of showing the cycle of OCD, right? So we start off here with an obsessive thought. So this is the obsession. That obsessive thought, as we mentioned, is unwanted, so it causes anxiety. In order to help reduce that anxiety, the person will engage in a compulsive behavior that offers some temporary relief until the obsessive thoughts, images, or urges come into their mind again, and the whole cycle continues over and over again. So, talking a bit about the epidemiology, there's typically two major peaks. The first peak is between the ages of 7 and 12, and in this first peak, males are more affected than females. Then in the second peak, which is around 21 years old, females are actually more affected than males. And so here's a general patient presentation for patients with OCD. These patients definitely recognize that their behaviors are irrational, and you might contrast this to Obsessive Compulsive Personality Disorder, or OCPD, where these patients for OCPD recognize their behaviors and then don't have any problem with them. This isn't the case in OCD. In OCD, these patients know their behavior is irrational and they don't want to engage in it, but they can't help themselves. They want to avoid the obsessions and they want to avoid the compulsions. Common compulsions you might be familiar with are hand washing, counting, checking doors are locked, hoarding, touching things. And so I thought I'd give some obsessions and then possible compulsions that a patient may engage in. So for instance, if someone has an obsession related to contamination or germs, their compulsion may be hand washing. Or if someone feels unsafe in regards to an obsession, they might be checking their door that it's locked or checking that their stove is off. Someone who is obsessed with symmetry might be counting and arranging and ordering things just to be sure that everything looks symmetrical. And then if someone's religious, they might pray excessively. Now, in regards to management or the treatment of OCD, the first line treatment is to give high-dose SSRIs. So one thing that's important to remember is that SSRIs take a couple weeks to kick in, and they're not the only treatment that helps with OCD. CBT, using exposure and desensitization relaxation techniques, plays a really major role in helping these patients address their obsessions and their compulsions, and really helps reduce the anxiety associated with their obsessions. So it's definitely recommended that patients take advantage of both of these resources, both the SSRIs and CBT, in order to best address their condition. Thanks so much for watching. Hope this video was helpful. If you have any questions, please leave them below. Thanks.